And we're live. Hello, it's Bill, the knee pain guru. Today is Monday, June 6th, 2022. It is D-Day. It can mean different things to different people. We are live today on Facebook, YouTube, Twitch, and Twitter. And we also have posted on it's my rooster, Gab, Parlor, MeWe, and Truth Social. So we are on a number of different platforms promoting this. The idea of these videos is to begin to give you a different way of looking at what's going on with your knees. The conventional medical model, while it has its place and its purpose, and can be very strategic in terms of helping you get from where you're at with knee pain out of knee pain. Many times we could find ourselves in gaps in that process that the conventional drugs, shots, surgery, and physical therapy is not getting us the results that we want. So with that being said, I'm doing these videos as a way of educating, of helping you understand. I'm going to close the window here. My rooster seems to like it when I go live and then starts crowing. Okay, if you have questions, please type those in the comments section. I'll take questions about your diagnosis, what you're struggling with, physical therapy, questions for your doctor, whatever it is, because many times everything that I'll share with you is all around recognizing when our nervous system, when our neurology goes into fear. When we go into fear, we make really bad decisions. Fear happens because of pain, trauma, accidents, injuries, surgeries. That happens in our life. All of a sudden we have blinders on, and then we make decisions that actually make our situation worse. So this is the idea of these videos, is to help you in the process of expanding those blinders somewhat so you can make better decisions, so we can right the ship, so to speak, and get you the relief that you're looking for with your knees. Today we were going to talk about increasing range of motion in the knee without force. And this is many times a very foreign concept, especially with the mentality of the society that we live in. You know, push through the pain, no gain. Pain is weakness leaving the body. And that mentality has its time and place. Pushing through the pain is important when we're being lazy. Pushing through the pain is important when our body doesn't start out in pain. Well, what I'm talking about is not that. We're going back, there's a step before that we need to look at, which is understanding that when we start out in pain, when there's some sort of neurological glitch that's going on as a result of an accident, an injury, a surgery, a trauma, that we need to address that glitch first. And when we address that glitch, then we can push. There's a timing in all of it, and it's a huge distinction. So questions are already coming in. Please type those in the comments section. I will get to those. Make sure to give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos. Okay, so I was making some notes here about my own process, because between December of 98 and May of 99, I dislocated my left knee 4 times. Had reconstructive surgery on the ligament in my left knee, did the surgery, did the physical therapy. 3 months after physical therapy, the doctor gave me the green light to go back to judo, which was exactly what I wanted, but my knee wasn't functioning like I thought. I had this idea that if they repaired what was torn and broken in my knee, that I would just be functioning like I did before the injury. It doesn't quite work like that. There is a mechanical component that we need to look at. Torn tendons, torn ligaments, torn meniscus, broken bones, fractured bones, worn cartilage and meniscus. There's elements of it that we need a mechanically sound knee to begin to move forward. However, once we get the mechanically sound knee, like I did, they repaired the ligament, they repaired the meniscus, I was still limping. The knee was still swelling up. I still got fatigued. My hips and lower back ached. I had all these other issues, even though the knee was normal. So this is what we're going to look at today, is looking at increasing the range of motion in the knee without forcing the knee joint. Because many times what'll be pointed to is that the knee joint will not get full range of motion because it's building up scar tissue. Or we need to strengthen the muscles in the legs, which is a component we need to look at. It's just not the whole story. So my process was, let's bring up an anatomy of the knee joint here. Anatomy. I'll share my screen here. Make sure if you have questions, type those in there. We'll get to these today. I will, before I get off the line, I will address all those questions. It's important that you ask questions, because sometimes we don't know what we don't know. So we're in the process of, okay, here we go. Here is a knee joint. I'm going to share this right here. Share. And if you want more information, you can head on over to my website, thekneepainguru.com, or give us a call or text, and we will be able to help you with stuff. More information. Okay, here we go. Here we got a knee joint. Can I get some confirmation that you're actually seeing this? Can I get, let's see, confirmation, yes, that you're actually seeing what the knee joint that is on the screen here? That would be extremely helpful. Okay. So here we go. Let's see. View tab, stop sharing. I think I got to do this a little different. Share screen. Chrome tab, anatomy of the knee joint. Nope. This one. Okay. So here's a knee joint. This right here is where the meniscus is. We got ligaments. Ligaments connect bone to bone. Tendons, these white parts, connect muscle, the muscles in your legs, to the bone. Bones in your kneecap, bones in the lower leg. And what happens is when we experience, I was talking about the accidents, the injuries, the surgeries, the trauma, all of this stuff starts pulling tighter together, squeezing. That's a normal, natural response to your neurology, your nervous system, to the experience of pain. And when that happens, this bone in the upper leg, which is known as your femur, and the bone in your lower leg, known as your tibia, squeeze closer together. So you think of it like a door jamb that the hinge is too close in there and you can't close the door. That's what happens in your knee when you have something traumatic that happens to it. And there's pain. And what happens is, as that knee joint squeezes closer together, the range of motion decreases. Your ability to extend the lower part of your leg or bring your heel to your butt decreases because of the tension that is happening in the joint. Now, conventional thinking is, well, let's strengthen the quads, let's strengthen the hamstrings, let's strengthen the calves, let's strengthen the shins in order to increase the range of motion in the knee. But what we're doing is we're starting out with a joint that doesn't have enough room to move in and of itself. So the more you strengthen your legs in this place, makes it more and more difficult to extend and bend your leg. It compounds the issue. And while you're doing that, you're forcing the joint. You're forcing the knee to extend. You're forcing the knee to bend. And you're putting the knee through more pain by trying to strengthen these muscles in the legs, in order to increase that range of motion in the knee. And what I'm suggesting is we can work with a deeper understanding of the neurology being your nervous system, your knee, and your leg, and your body's experience of comfort, that switches the neurology from a sympathetic state, which is a fight or flight state, to a parasympathetic state. Parasympathetic is a rested and relaxed state. And when the body is in a rested and relaxed state, the knee joint relaxes. The knee joint feels comfortable. The knee joint feels safe, supported, and listened to. And what ends up happening is there's space that's created in the joint. So if you're listening and you've been diagnosed with arthritis, or you've been diagnosed with bone on bone, you've been diagnosed with some sort of knee pain that's nondescript, we're looking at nerve irritation in the knee that's causing the joint to squeeze closer together and squeeze out the synovial fluid in the joint that makes the knee joint make the knee joint be stiff and achy and painful. The more you push the knee in this place, the tighter the knee joint gets. So we begin to reverse that process by creating comfort in the knee, relaxing the neurology, and more space is created. If this is making sense, give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos. Okay, let's see. We got some questions that have come in. Let's talk with Leonard. Leonard, how have you been? Leonard writes, hello, Bill. I had an ACL and meniscus reconstruction 16 years ago and have not recovered full range of motion post-surgery. How does time factor into the equation? Well, here's the interesting part about when we're looking at the neurology of the knee. The nervous system. And what, Leonard, what we're essentially talking about is trauma that gets stuck in your neurology. Trauma doesn't have a recognition of time or space, meaning you'll still have the same feeling of what went on with your knee when the injury happened in the past, and the anticipation of what would happen with the knee in the future as far as pain goes. And what it's keeping us from doing is being very present to what's going on with the knee. The more we can get present to what's going on with the knee, the more we can release the trauma from the anticipation, or I'm sorry, what has happened in the past and the anticipation of the future. We bring ourselves present to what the knee needs right now in the present time. And what can happen is the knee joint is the neurology is able to release these tension patterns that are going on, and you can increase the range of motion in a very short period of time. I am working on a blog post I should be posted here shortly. I was going to embed this video into the blog post, and it talks about my experience of what is known as an external femur rotation. That's a fancy term for the upper part of the leg was rotated out from my knee injury. What happened was that rotation in the bone in the upper leg didn't allow the folding of the lower part of the leg with the upper part of the leg so I can kneel in judo. That was my deal. And the more I was able to release that tension pattern that was going on in the femur, which also affects what's going on in the hips and lower back, the more I was able to release that external rotation tension pattern that was going on in the femur, the range of motion increased like that. And actually the scar tissue shifted on my knee from the ACL reconstruction. So it's totally doable. A lot of times it's the belief and the understanding of how the body works that is preventing us from allowing the body to heal. And all we need to do is begin to take a step back, breathe, like calm ourselves down. Because when we get in that very worked up state, we don't see the solution. And in doing so, we can begin to release these tension patterns, and the body can increase the range of motion without pain, without forcing the joint, without exercise. Like that is the crazy part. You can do all of this stuff by tapping into the neurology of what's going on in the knee, not forcing the knee joint to do something that it doesn't want to do. We could force the joint later. We could strengthen the muscles, strengthen the tendons, ligaments, and fascia in the knee later, once we get a comfortable, balanced foundation to begin working with in the knee. So if that makes sense, make sure you give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos. Okay, so Leonard, hopefully that answers. And if you want more help and support, please go to the link in the description box, or you can, there's the information in the scrolling bar. Get more help, get more support. This is all I do. This is my day job. Okay, Elizabeth writes, is bending the knee beyond 90 degrees meant to improve tightness in the knee? Okay, sometimes the way questions are worded, I'm not exactly sure what we're looking for. And I'm going to guess, Elizabeth, and forgive me if I guess incorrectly. I'm assuming that the knee is kind of loose, and we want to exercise the knee as a way to tighten it up so it isn't so loose. And getting the knee beyond 90 degrees is not necessarily the goal. We want to tighten up the tendons, ligaments, and fascia in the joint, which is apples and oranges compared to strengthening the muscles in the legs. Strengthening the muscles in the legs is one thing. Making the legs stronger is one thing. Strengthening the tendons, ligaments, and fascia in the knee joint is completely different. So usually it's time under tension of the knee joint that builds the strength in the knee joint that will stabilize the joint. So then we read the rest of what Elizabeth shared, and she says, I get more knee pain with this bending. And that's where I was talking about a moment before. We want to create comfort in the knee joint so the knee joint doesn't feel pain. And when the knee joint doesn't feel pain, then we can focus on exercising. Because exercising with a comfortable joint, you're going to get stronger and faster and not build up that apprehension of building strength in the joint if the knee is comfortable to begin with. If this is making sense, give the video a thumbs up, like and subscribe to the channel. Turn on notifications for future videos. Okay, so Elizabeth, hopefully I answered that question for you. If I didn't, please type it in the comment section of this video, because I will see the comments that come in after the live stream is off, and I use those on future videos for topics to talk about on future videos. So, good question. Okay, Ginger writes, I've had a real problem with both knees and have recently gotten a mobility Liberty trike. I realize that my knees are stiff. Will they loosen up after a while of biking? Can I expect improvement? Now, it's important to exercise is important. Like that is a baseline. There is truth to use it or lose it. However, there's a caveat to that. We want to make sure when we're using our knees, when we're exercising, that we're not causing more pain and trauma and causing the knees to tighten up worse after exercising than it was before we exercised. And this is what I'm talking about. Many of these questions, and this is no fault of any of the people asking the questions, but this is why I'm having these videos. I'm hosting these videos because we're starting the conversation at B. We're talking about B, we're talking about C, we're talking about D, but there is an A we need to have the conversation about. And that's the purpose of these videos, to educate that in order to get the results you want, in order for the knee to feel like you want it to, we have to change the neurology in the knee by shifting the neurological state of the knee to a place of comfort, shift it to a parasympathetic state. And when you do that, the relief in the knee is pretty immediate. The relief in the knee is palpable. The experience of recovery increases because the knee is not now at a baseline in pain all the time. The knee feels more comfortable. You have the tools you need to work with to create comfort in the knee whenever you have discomfort. So now you can go exercise with more comfort in your knees. You can push the knee more. You can push the knee longer, the legs more, the body longer, because you've gained the tools and knowledge and understanding of how to create comfort in the knee. We're addressing A. And then the improvement is not going to be necessarily from the cycling. The improvement is going to be even before you cycle. So you can see how we're backing up the conversation, and we're going to be more effective, more efficient, get better results in a shorter period of time if we take a step back and have that conversation about A in the process. If that's making sense, give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos. Okay, Melissa is here. You can hear. Let's see. Aunt Patty is here. Could be bigger if you can. Okay, the knee. Yeah, that's the video. Let me see if I can do this. Yeah, StreamYard is a little fussy sometimes. Okay. See, Aunt Patty writes, bone spur on the inner knee. Okay, bone spurs. Bone spurs. The body has, and this gets into having a conversation about water. When the body develops bone spurs, women or people who are dealing with osteoporosis, there is a hierarchy of water allocation in the body. When the body is dehydrated, when you don't drink enough water, and or the body isn't able to absorb the water that you're drinking, that looks like, well, I drink a glass of water, I'm peeing 5 minutes later. That means the body's not able to absorb the water that you are drinking. When those two situations or one or both of those situations are present, what happens is the body has an allocation of water. It has to keep the brain, the blood, and your organs functioning properly. Because if you don't have your brain, your blood, your organs functioning properly, you die. So what will happen is the body will go and rob water, hydration, from the bones and the synovial fluid in your joints. And when it does that, it keeps your brain functioning properly, the blood circulating properly, and your organs functioning properly to keep you alive. So you don't need your limbs, you don't need your joints to function to keep you alive. So what ends up happening when we have these states of chronic dehydration, the body is going to the bones and the synovial fluid in the joints, robbing the water from those areas to keep those other areas functioning properly. When it does, it begins to leach out the calcium in the bones and then deposit these as bone spurs. in and around the joints. That's what happens with the development of bone spurs. The idea, what we need to do is make sure we get the hydration down as a baseline, like a foundation that we're setting up in a way where we don't have a further degradation of what's going on in the body. And then looking at how bad is the bone spur? Like, is it a big one? Is it a little one? Is it in an area that hurts a lot? Many times when we begin changing the neurological signaling in the knee, we can create enough space to get the pressure off of the bone spur and the pain goes away. If the bone spur is really large, it can cause more damage. We may have to look at medical support in order to remove the bone spur in a way where we get the bone spur from irritating the joint more, and then we can go back to our life. But we want to have both a short-term and a long-term strategy. One is making sure the spur isn't irritating the knee joint, and then we also want to make sure we're not setting up the conditions in our body for further bone spurs to be created. Because whenever we have an issue that we're looking at in our body, it doesn't happen in a vacuum. A bone spur does not happen in a vacuum. There is an environment that supports the formation of the bone spur. And if we aren't looking at the environment and willing to make changes and test and course correct of what's going on in the environment, well, more bone spurs are going to be created, and then we're going to be in the same place that we were before, which is the definition of insanity. So we need to take a step back. We need to be strategic about what we're doing. So hopefully that helps. Ginger says yes, she can see that. Rhonda signed up for our knee club program. And Rhonda, just so you know, you should be receiving an email, probably already received the email in your inbox, and we'll be going live at 12:30. So that'll be about 28 minutes from now. I'll be finishing up this call. We'll be jumping in a Zoom room and we'll be addressing your specific situation. That's my group coaching program that Rhonda joined. And what we do is I'm giving you the mindset in order to get out of pain. But there are specific things we need to do, locations of where we can create comfort in the knee to change the neurological signaling. And that's what I do in my group coaching program. So Rhonda writes, that is what's happening to me right now in physical therapy. Scar tissue and osteoporosis in my left knee. It is so tight, my range of motion is at 74 degrees. So what you and I will dig into later today is how can we create comfort in the knee joint so the joint feels safe, supported, and listened to. The joint relaxes. When the joint relaxes, the range of motion begins to increase. And we begin to do that on a consistent and a regular basis. So what we're talking about today is significantly different from week to week. So you can increase your physical activity and not have the pain. And if pain does come back for whatever reason, now you have the tools to begin to relieve that pain, and without drugs, without surgery, without shots, without painful physical therapy. So we'll get you there. Okay. Question here from HR Ford. Hello, Bill. Thank you for your chat. I had a total knee replacement in mid-January, but last month having severe sciatic pain in my butt. Can I use an inverter to try and alleviate this pain? Thanks. Okay. We need to talk about tension patterns. Think of it like there's a concept known as tensegrity structure. Let me get an image of this up. Tensegrity, T-E-N-S-I-G. Tensegrity structure of the leg. So I'm going to share this. Okay. Let me show the screen here. Wait, I got to get the image up. Okay. remove that. Stop screen. Share screen. And what we're going to do is we're going to do a window. Let's do the Chrome share. Okay. And let me make sure. Nope. Ugh. Let me stop this. Let me go here. Okay, here's a good one for you. View this image. Let me see if I can make this a little bigger. It's not working. Hold on a second. Be patient with me. Tensegrity structure was made famous by R. Buckminster Fuller. It's based on systems theory. A geodesic dome, Epcot Center, a bicycle wheel, all of these are tensegrity structures. Let me share this. I have a tensegrity structure of the leg here. Nope, that one right there. Okay. Share screen. Chrome tab. Nope, right there. Okay. This isn't the best one. Let's see. Hold on a second. Okay, HR Ford. This isn't the best one. However, it's going to work for us for now. But the idea is, like in a bicycle wheel, you have, when the bicycle wheel's in true, when it's balanced, the tension in the bicycle wheel is balanced, that bicycle wheel can support a tremendous amount of weight. If we take some of those spokes and loosen some and tighten others, the bicycle wheel comes out of true and it'll wobble, which means it's going to wear, the wheel is going to wear unevenly. It's not going to be able to support as much weight. Our body functions the very same way. When we have a tension that happens as a result of accidents, injuries, surgeries, traumas, the body will get excess tension. Like I'm sitting in a chair, we're sitting in front of a computer all day, we get more tension forward in our belly and in our hips. Our hip flexors get shorter. So what ends up happening is when I get up from this position, there's an imbalance of tension in the front part of my body. Now I'm trying to straighten up and stand straight, but I still have that tension in my hips, in my lower back, in my belly, which causes more pressure to go down into my knees. And you can see by this image that there's this balance of tension that's going on in the leg that keeps the leg there is a certain amount of tension in the front and the back of the leg, rotation, inside, outside of the leg, that keeps the leg in balance. If there's an imbalance of tension, the wearing patterns in the knee are going to be shifted to the inside of the knee, the outside of the knee, the front of the knee, the back of the knee. That'll be diagnosed as arthritis or chondromalacia or patellofemoral syndrome or whatever that is. And it's based on the balance of tension in the leg, in the knee, in the body. So I'm going to land the plane on this for you. When we're looking at having a total knee replacement, there is a certain tension pattern that the knee replacement, because the nerves are no longer being irritated in the knee because the bones in the leg have been cut off and they've been replaced with plastic and metal, you can't feel that pain anymore. That doesn't mean the tension pattern has been addressed. So what happens is that tension pattern in the tensegrity structure gets shifted. Now you're feeling it in the sciatic area, in the butt. So all hope is not lost. We can address that. And it's what I do address in my program. but we have to understand that this is part of layers of stuff that is built up in the physical body over time. This is not necessarily a quick fix kind of thing. This is a process that you undergo, a journey that you undertake that allows your body to let go of years of accidents, injuries, surgeries, traumas. Melissa is on the line here, and that's something that we have worked. She has had 2 total knee replacements, and we have worked with that layers and levels of tension. Oh, which Melissa, you had asked about there's a different pricing structure in Knee Club right now. You can go to under the products link or products tab in the Knee Pain Guru. You could check that out. So it's access to the virtual clinic. So that's something you can check out. Okay. So HR Ford, hopefully that helps. That when I'm not saying knee replacements are bad because they can be valuable. There was a gentleman I spoke with that had no ligaments in his knee anymore, and he would step and his leg would collapse. So there are certain situations that of bone on bone that knee replacements can be extremely valuable for, that can make life functional again. Many times when a person is dealing with advanced arthritis or bone on bone, we can work on reestablishing the tensegrity structure in the body, and relief can be had, pain goes away, and mobility and functionality of the legs return without ever having to have a knee replacement surgery. Now, if you have had a knee replacement surgery, there's still plenty to work with. There's still lots of tension patterns that we could address. HR Ford said, can you use an inverter to help? Possibly. It depends on how the tension pattern is in the legs. There's tension patterns in extension. There's tension patterns in compression. If you have a tension pattern going on in compression in your leg that's affecting the sciatica, and you try to stretch that, that can actually cause more pain. So we need to understand these tension patterns on a deeper level, just like we would on a bicycle wheel. Your question would be akin to, well, the wheel's crooked. If I push the wheel straight, will it help? Possibly. However, what we really need to do is look closely at which spokes of the wheel are loose and which spokes are tight, and get the spokes aligned so the rim goes back in alignment itself. So it's one of those things, and this is part of why I'm having these videos, is we need to understand a deeper level of what's happening in the tension patterns and how that shifted from your total knee replacement into the hips and lower back, how it's affecting the sciatic nerve, what's going on in your lower back, what's going on in your hamstrings and quads. So it's a deeper conversation. Try the inverter, see how it goes. You want more support? Reach out for help. How about that? Okay. Okay, all is fine with knee, recovered from replacement very well. And that's great. That's great. On a surface level, you're correct. On a deeper level, you're having sciatic issues. And this is one of those things that the body, the trauma that went on with your body for years that led to the pain level you had, the wearing of the joint, to having to have a knee replacement, like that doesn't go away. It just shifts to other areas. And, if you're happy with that level, awesome. What I'm talking about is a much deeper awareness and understanding of what's going on in the body. Your choice, either is fine with me. Okay. Melissa writes, how do you strengthen fascia, ligaments, etc. that you talked about? Maybe the mobility series. No, not the mobility series. It's time under tension of of a joint. So the longer a joint is under tension, the muscles are fatigued, and what's left to work with are the tendons, ligaments, and fascia. When the tendons, ligaments, and fascia or the muscles are out of the way, they've been sufficiently fatigued, then the tendons, ligaments, and fascia are strengthened. Okay, Melissa says, your program has helped me so much, and I have little pain in my knees now, but the poor range of motion is impacting my back and sciatica pain. And I'll point this out to HR Ford, wink, wink, nudge, nudge. Melissa had 2 knee replacements as well. So the range of motion is what affects other parts of the body. And when we don't have that full range of motion, it could be there's issues. Anyhow, if that makes sense, give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos. Rhonda says, thank you, Bill. Of course, you're very welcome. I am all for helping those who are interested in learning more about their body discover as much as they can. I've been on this journey for 23, 24 years now, thinking that when I injured my knee and I had the surgery, I just wanted to get back to judo so I could throw people again. And it went down a much deeper rabbit hole for me. So it's been 24 years in discovering secrets of the nervous system, how the body holds tension, how the body holds pain, the pain, tension, and discomfort, how it displays in the physical body, and what we can begin doing to set up the conditions so the body is able to heal itself. So as deep as you would like to go down that rabbit hole, I'm able to take you, or as short as you want to go down that rabbit hole. Some people, just like they want the knee out of pain, they want to be done. Great. That's cool. If you want to go way deeper, I see it as a lifetime study. So, okay. I have a short video I'd like to play for you before we wrap it up. I have my knee club group coaching program here at the half-hour mark, 12:30 Eastern time. I have them on Mondays at 12:30 Eastern, Thursdays at 5 p.m. Eastern, and that's where I take this, like Rhonda. I was just talking with Rhonda about what's going on with her knee. I will give her specific videos in the members area of my website that will relieve her pain right now. And when her pain is relieved right now, she's going to have a different experience, a different awareness, a deeper understanding of what's going on in her knee. And that's where we have this dialogue. So if she has pain on the inside below her knee and right at the knee joint, and we release that tension pattern, the pain may move, may shift, may change in some way where it's like it feels different somehow. I'm there to explain it. I'm there to describe the process that your body's going through of undoing the years of accidents, injuries, surgeries, and traumas that are going on in your knee and in your body. The more we release these tension patterns, the more freedom you have of movement, the more flexibility and mobility you have in your movement. You don't feel as a victim of what's going on with your knee. This is a concept that I refer to as medical sovereignty, that you're taking your power back and you understand the role that a doctor plays in your healing process. A physical therapist plays in your healing process. A massage therapist, an acupuncturist. You understand better when you have input from your family, your friends, and your loved ones who tell you, like, well, that's just what happens when you get older. And you're seeing this experience of having more freedom of movement, more strength, easier breathing as a result of changing these neurological signals in your body. So they're completely allowed to have their reality. You're allowed to have a completely different one. That's the path that I chose. I am absolutely happy to share that with anyone that is interested in discovering that as well. have some new comments here. Okay, thanks, Bill. I check out your new structure. Yes, we have. There is in Knee Club. Knee Club, I have a approach where you can get my support in a group coaching context twice per week. There's also you can just get access to the videos if you want to do it yourself in your own time, no pressure. You can get access to those videos as well. There's two different structures for Knee Club. You can check that out. You can head on over to thekneepainguru.com. You can also shoot us a text or give us a call on our toll-free number, 877-891-9484. All of that is also in the description box below. And like I was telling Leonard earlier today, or earlier in this live cast, that I'll be sending out a blog post. I just have it about complete regarding the range of motion in the knee and my experience of releasing that tension pattern from my own knee injury. Okay. Well, let me share this video with you real quick. If you have any more questions, you can type those in the comment section, and I'll be right back in about a minute, and we'll talk more. Okay, here we go. Okay, we're back. Bill Paravano, the Knee Pain Guru. Okay. We've been going 48 minutes now. These are all great questions. We'll be doing these videos, I think, about once a week. If you want these questions. Okay, Josh, got a question here. Bill, crazy scenario. Re-aggravated an existing case of chondromalacia. A year of zero improvements. I contracted Rocky Mountain spotted fever that drove the pain on antibiotics. Any tips? Yes. Tips: plant your corn early. Never park your camel out in front of your tent. With chondromalacia, there is an external rotation of the lower part of the leg, which makes the IT band very tight. So working with that tension pattern, changing the neurology, like from my perspective, creating comfort in that tension pattern will release what's going on in the lower part of the leg. It'll also release up the IT band. There are specific ways of creating comfort in the IT band that will help with that. Structure governs function. So if we get the structure correct, the Rocky Mountain spotted fever can be isolated and addressed without having the pain of the structure that's affecting the pain. Like we want to separate. We got the Rocky Mountain spotted fever. We have the chondromalacia. We want to address the structure of what's going on in the body first, and then the experience of what we have in the knee as a result of the inflammation or addressing the bacteria. I think it's a bacteria. You can address that separately. If you want more help and support, I have some people we could pull into the conversation on that can help like working with the program that I offer is going to be an element of addressing the structure component. And then I have other people that I work with that are exceptional that can bring in components for the Rocky Mountain spotted fever that can help with that as well. So it's when we're in pain, it's always a crazy scenario, and that's because pain affects our mind and our emotions. And I wrote an article about that last week. I'm going to do this real quick because I got to scoot to get on my knee club call here shortly. But I want to show you this article that I wrote that addresses, I called it Panic at the Knee Joint. Okay, Chrome tab, knee pain guru. Okay, share. So this is where you can go. You could sign up for my mailing list. You can put your phone number in there. We'll give you a holler to talk to you more about how we can help you. However, was it Josh? I think it was Josh. Yeah, Josh. Okay. This article right here, Panic at the Knee Joint. And I talk about the role the mind plays in dealing with what's going on with pain. And a situation tends to be complicated when we let our sympathetic nervous system, or like monkey mind or reptilian brain, kind of run with everything. When we're really get sucked into the fear of a situation. But many times when we take a step back and we get a step-by-step strategy, we can start making some ground in a very short period of time. So, Josh, I'd encourage you to check out this article here, Panic at the Knee Joint, and then reach out, and we'll get a real solid strategy moving forward for you. So, okay, I got to scoot. I got to start with my knee club thing. If you want more information, you can head right over to here, Knee Pain Products. This is where you can sign up for the different programs, Knee Club Lite, Knee Club Premium. And then if you'd just like to talk to me one-on-one, we have all the different options there for you. You can check that out. So, okay, I got to scoot over. I'm going to be helping with, I'm going to be doing the Knee Club Premium program. It's starting up here in less than 2 minutes. So I got to go talk to Rhonda over there. So I'm going to remove this. I thank you all very much for showing up. I thank all the great questions that came in. If you're watching the replay of this, please type your questions in the comments section. I will use those for future videos. I appreciate you all very much. I know the world is a crazy place right now. We keep breathing, and this ties in with that fear. Read that Panic at the Knee Joint. Everything we're dealing with right now in the world is around calming the neurology down, and we can do that through meditation and breathing. We do that through prayer. We could do that through herbal supplements or homeopathics or things like that. We could also work with the neurology in the way, is what I work with in Knee Club, of calming the nervous system down so it gets mellow, and then we can see things for what they really are. Okay. Thank you all very much for being here. Have a wonderful day, and I will see you on the next one. Have a great one. Bye-bye.